Welcome to the New Health Paradigm Call. We are Team Masterpiece. I'm Nikki, and we have a guest speaker today, a returning guest, Dr. Vlad Karali. He's I think he's still from France. I know you moved recently. Yeah. He is a integrative dentist, and we often have questions about dentistry. And the first time that we had you on a few months ago, I think it was January, February, that was a big hit and we're looking forward to more information. I think you're going to be talking about an integrative aspect of health regarding possibly dentistry. Hopefully, you and I haven't really talked in detail. I know you have a slide presentation, and what we're going to do, like we do always, is we're going to allow our guest speaker to show their presentation and speak about their topic for about 45 minutes up to an hour, and then we'll have Q&A. What you can do, as always, is you can use the chat function to send a question or a comment to myself, or Matt Senna is here as co-host, I see, and I can ask those questions to Dr. Karali, or he can, well, no, he can't see them in the chat. That's right. So I will ask those questions if anything comes up midway. Otherwise, hold them till the end, and we'll have plenty of time afterwards. So without further ado, thank you so much, Vlad. I really appreciate your time again today. I know you take great care in giving your presentations and doing your slide presentation, and I really appreciate that. Visuals are always good. So I'm going to give you the floor, and you can go ahead and screen share. If my camera's off, I'm still here, just taking notes.
Thank you, Nikki. So let's see about that sharing capability. All good?
Yep.
Okay. Feels like a show and tell. I like it. So indeed, I have prepared something for today with some pictures. First of all, I'd like to thank you, Nikki, and the whole Masterpiece team, which I greatly appreciate for having me for the second time, which is a great honor for me. And I think there's lots of topics to be explored. And I really like the emails you guys are sending, which are very informative. And for me, it's a great source of inspiration. And it's like the rabbit hole. Once you go down, you can't stop. So thank you for that. And without further ado, so the presentations have been made. I'm holistic or integrative dentist here in Lyon. I was in Paris the last time we talked. And I came back to Lyon where I live. And today, the topic of the presentation is dental materials. So before getting to that, for people which haven't been on the first call, I'd like to introduce the holistic dentistry topic, let's say, or integrative. So basically, holistic dentistry is a different way of looking at the patient, which takes a particular approach on we look at more than just the mouth, because when we say dentistry, it's basically the doctor of the teeth. Well, I like to naturally get out of the mouth and start looking at the whole body. So it's a natural approach and the whole body approach to the oral health and more. And as you can see on the slides, we have lots of tools at our disposition, like prevention, psychology, naturopathy, a lot of osteopathy. Then we have inspirations from Ayurveda, and I really like the last call with Rosa, where you touched on the oil pulling as well, and also the ancient Chinese medicine is of great help. Now, why does dentistry matter? Because on the surface of it, it's like some people say, it's just a tooth. Basically, the tooth isn't just a tooth, it's a organ, because if you think about it, we have the baby has the teeth inside his mouth, in the bone, and then at one point they start to erupt. So what is really fascinating for me is that actually teeth are organs, inside organs, which go to the outside because you open your mouth, so you're in contact with the external environment. And then there's this tissue around each tooth, the periodontal ligament, which acts as a barrier. So for me, basically, the mouth is the first part of the digestion, and it's like the lining in your stomach or intestines. So it's basically part of the whole tractus, if that's the right word. And on top of that, you have also stuff being done to the teeth, which is where my topic today comes in, where you have cavities, so you have bacteria, infections, and then you do the treatment, and it's not enough to say, okay, the cavity has been filled. It's also important to know with what it has been filled because it's part of your mouth 24/7 and it stays in your mouth for a very long time. So you can have interactions with the immune and the nervous system. And also there's a lot of influences from the mouth on the whole body, like the digestion, breathing, and the posture is indeed a big topic as well, which we treat in integrative dentistry. So to get to the dental materials, like I've said, they are materials used to restore, replace, or protect teeth and oral tissues. And they're an integrative part of our trade because you have to basically use them to recreate the tooth structure. So they they will be used in fillings, in crowns, implants, and dentures, and even in orthodontics, where you put foreign materials inside the mouth, and they stay there for 5, 6 months, 1 year, 2 years, sometimes even 4 years for the braces. And I'd like to go into the history of dental materials. So if you look at the text and the things we have available in the museums, the ancient dentistry actually was a quite phenomenal way of treating the teeth because I find it to be very artistic in the way that especially the Etruscans they were replacing teeth. It's quite craftsmanship. So the ancient Egyptians they use natural let's say ingredients, materials like beeswax or gums and resins from different plants, and also gold. And what we see here in the picture, this is the Etruscans, which have been using the gold. I think it's called foil or plates. What we see in the picture, and usually it was natural materials. Here in the second picture, for example, we can see teeth being held together with some gold wire. And the materials used are they were usually bone, ivory, or pieces of shells, and sometimes human teeth. And now, if we go further to the Middle Ages, this is where things started to change, and the craftsmanship part of the dentistry started to fade. And here we get into more what's the good word? Like dentistry started to become more effective in the way that you had the pain. Okay, the main treatment was the extraction, so everything went away, pain went away, bacteria went away, but they weren't paying that much of an attention to replacing them. And for sure, there hasn't been this level of artistry which we saw in way back in the ancient period. And everybody knows the dental chair. Basically, the dental chair comes from the barbers, so that's our heritage, because barbers were the first to treat teeth. They even had the word barber surgeon. And in France, it's a chirurgien dentiste, so it's a surgeon dentist. which has the roots way back in the Middle Ages. And here as well, we can see teeth being made from animal or human teeth and ivory, which has been a great source of prosthetic teeth. But the main part to focus on was this quite brute approach of treating patients, where you just pull the teeth out. Now, if you go back to the period of the Renaissance, here we can see basically the same, more or less the same parts of the same materials, sorry, but we see an increased use of metals. So here they started to use to make fillings with the gold foils. So they learned how to pack the gold foils. Before we had these bands and these wires, sorry, in the ancient times. And here we have more materials which are better treated or fabricated, as in the gold foil, or we have lead and tin, which have been historically been used in this period for filling the cavities. And given that we have this shift to metals, there's this practicality part as well. So like I've said earlier, for the ancient times, there was this craftsmanship, which started to get lost. And here in this period, in the Renaissance, we still treat extractions the same way, but there's this improvement on the materials being used and also in the instruments, which improved because they were from metal, and we started to work metal more. And there's an interesting story about tomatoes. I don't know if people know it, but in this period, people feared the tomato or tomato because people, especially the higher ranking noblesse, I don't have the word, but the rich people in the community, they've been eating tomatoes from their silverware or the plates, and they were dying. So there was this mass hysteria around tomatoes. Why are people dying from tomatoes? And they called it the poisoned apple. And what was actually happening? There was lead in their plates. So the tomato being acid, when it was being put on the plates, you had a reaction with the lead, which would go into the tomato and thus kill the noble people. Sorry for my English. Here we can also see some instruments from the same period, and there has been a big change, which has been brought forward by Pierre Fauchard, which is considered to be the father of modern dentistry, which has been creating these protocols, and he paved the way for the modern dentistry today. And here we can see more attention being brought to the functional aspects, and we start to go into replacing teeth with new materials. As you can see here, the porcelain teeth has been introduced, and the dentures started to appear in the 1850s from vulcanite, which is not used anymore today. And then we go into the 1800s, which we could quite well call the dental amalgam era, where you still have this focus around metals, and you have the famous silver fillings which started to appear, the dental amalgam. In its composition, you have silver, tin, copper, and about 50% mercury, which back then they didn't know that it was toxic. And this habit, let's say, lasted for quite a decade. of using amalgam, and even today there are places where amalgam is being used because it's cost effective, it lasts for a very long time, and it also inhibits the bacterial growth. So indeed, there are some people saying that the silver fillings, they're very good, you don't see cavities underneath, etc. Yes, that is true, indeed, compared to the more modern resin materials, but you have all this metal inside. So we know you also from the studies with Masterpiece what metals inside our body can do. And on top of that, you have the proved neurotoxin, mercury, which is inside. I think I have a slide afterwards, yes, about the proper way to eliminate the silver fillings, because the two most important uh, parts when mercury is being released the most is when you put it inside the tooth, and as well the second part is when you take it out. So that's the most dangerous part of the dental amalgams. Now, in the 60s, there has been this great revolution of plastics which have been introduced, and of course, this has also been translated to the dental profession, where we started using what we call composites, which are based in petroleum products, so basically the plastics. And of course, it was a big hit because all of a sudden you could have fillings which were the same color as the teeth. And also you could restore the tooth. I wouldn't say easier, because amalgam, I remember in the 2011, I was still in the dental faculty, and they showed us, even though it wasn't used anymore, they showed us how to place an amalgam filling, which I can say for lots of dentists is a piece of cake. You just take it out of the box, stuff it into the tooth, and you're done. So the resin, the composite resins, they started to appear, but it wasn't the how to say it. People were demanding it because of an aesthetic motivation, but dentists were still reluctant to put it because you would need to better isolate the tooth in order to have the bond, which is chemical, which you don't have on the amalgam. Now the better part about this is they are less invasive, because for an amalgam filling to be retained without being bonded, you would have to cut inside the tooth something like this. So if you put it in, it's going to harden, and when it hardens in this shape, it can get out. We don't have to do this with the composite resins, where you can have basically the cavity as it is, and you're just going to bond. And the bond today is quite strong. Now this is all good, but you have toxicity which comes with all these materials. And why does toxicity matter? Well, the concerns are the accumulation in the tissues, the corrosion, which can happen in the oral environment, which is moist, and then you have the electrolytes as well in the saliva, which would create currents. So that's another issue, the electrogalvanism. You have you can see oral irritations around some of these materials. We talked about the toxic effects as well. You can have allergic reactions, tissue irritation, and also um, health problems, which are further, I mean, they're in the body. They're not only local. So therefore, the materials must be biocompatible and should not cause all these reactions. Next slide. Here we can see the components, the main components of the resin composites. So you have the filler particles, which usually is glass or ceramic. And then you have all these man-made chemicals, which are plastics. And here you have the TEGMA HEMA, and bis-GMA. This is the bisphenol, which I'm sure most people know about. And this is what sparks controversy with the resins, because I think in the US as well, the bisphenol, it was in these receipts from the grocery store. And here, at least in France, they got banned. They can't use that anymore. So I think they shifted to thermal printing or something like that. So you won't touch the receipts with bisphenol. And this has been 4 years ago, I think. And then you have some coupling agents, which are also chemical, and the photoinitiators. These are other chemicals which are used to harden, because most of the composites, they harden with this blue lamp. So all of this chart is going to create lots of polemic, is that a good word? Around its composition. Now, the modern advancements basically are around these materials, because now we start to have inert materials which we can put inside the oral environment, which is porcelain or zirconia or the lithium disilicate. This is the Emax. I think that's something people would know about. And then you start having we start having these bioactive materials like MTA, for example, which is short for mineral trioxide aggregate, which is used for the vital pulp therapy. I had some videos on Instagram where I was talking about cases where we have the option today to keep the vitality of the tooth instead of doing the root canal, which is a big plus. And the advantages, of course, of these new materials, as you can see on the screen, it's their natural appearance. So we can do teeth with these inert and safe materials, which also have a good finish, a natural finish. So you won't see any differences between a natural tooth and prosthetic tooth made of ceramic. Now, there are a couple of ways to look at all these biocompatibility issues. What I use in my office is the immune testing, which basically looks for low-level hypersensitivity. It looks something like this. So it's basically a report after having the blood being drawn. And you can choose as a dentist what do you want to test for. And here you can see the same elements which we saw earlier, like the bisphenol, HEMA. I can also test for titanium, even zirconium. And it's a test which takes place outside of the body. So they take the human blood cells, they put it in contact with each of these elements which has been chosen for the test, and it's going to show us the lymph reaction. So if there is a reaction outside, that proves that you have a reaction to these materials. So this quite often explains the symptoms that the patients have. And what really annoys me, I can say, that would be the good word, is that lots of times, because other people which are treating these patients, so maybe the dentist or the general practitioner or others, they are unaware of these effects on their patients. And lots of times I see patients which have seen other professionals, be it dental or not. Nobody found anything. And after having done 5, 10, 15, the conclusion was, okay, go home, it's all in your head. When we have all these tests which can prove that that no, it's not in their head. Sorry. So we can test for the resins in the dentures as well, which have some of the same components. And the dentures, they also can cause irritation or have the patient, they have burning sensations, or you can have this low level hypersensitivity, which is basically you have four types of, let's say, allergies or sensitivities. And the real allergy, the allergic reactions, that's type 1. So you have three more, which are not that evident. You would have more chronic symptoms like having headaches, having fatigue, unexplained fatigue all the time. You could have issues in the bowel movements, for example, or the burning sensation, having a metallic taste in the mouth. All these can be signs of incompatible materials. And there's also, for those that do not know the term, there's also, what was it called? I think it's this, in English, is this syndrome of breast implants. Because basically the breast implants, they also have resins and silicones, which stay inside your body and can give similar effects to the ones in your mouth. And I'd also like to add that from my point of view, the mouth is, I think, is the only place where so many work gets done over the course of the lifetime of a person. You don't really have the breast implants for everyone. You don't have, I don't know, maybe some valve replacements. All of the other interventions or materials which go inside the body, they are not so widespread as the dental materials which we use on the great part of the population. Because let's face it, the dental cavities are something which are everywhere. I mean, most of people have had at least one cavity. So that's it. That's why it's important to first think, what are we putting inside the cavity and what would be the effects. I'm looking at the time. I have this ranting ability which gets on sometimes when I do presentations. Sorry for that. We talked about the mercury, and electrogalvanism is what we talked earlier, which is when you have different metals in the mouth, is going to create this swap of ions from one metal to the other if they're different, which is the same mechanism that happens inside the battery. So basically, you have a battery inside your mouth, which is going, of course, to have the different, especially electrical effects that you know from the masterpiece studies. And I promised to talk about the safe amalgam removal. And this is where masterpiece comes in, because I find it very handy to go inside the tooth and chelate. You have the image on the screen. This is part of the protocol. The idea is to have the tooth being separate from the patient, I might say. So you have a hole inside the rubber, the blue rubber thing, which is a rubber dam. And we pass the tooth through the hole. Then you cover the patient's, so it covers also the mouth, so he can't have the vapors go inside his mouth or her mouth. And then you have the charcoal filtered mask on the nose and on the eyes to protect these latter. You have to use high suction close to the tooth, because when you're drilling, you're going to heat up the silver filling, the amalgam, and that's where the mercury vapors start getting released, and that's where it's the most dangerous. So in order to have the least amount, here I use masterpiece to put inside the tooth. So I put it on a little cotton roll and a bowl, sorry. You can see at the tip of the pipette. And then I put it inside the tooth to, after removing the amalgam, of course, to go inside the tooth and pull out the metals inside. So that brings me to my to the end of my presentation. My last slide. I'd like to do a quick recap of what we've seen. So the metal materials have been here since the ancient times, and what I've noticed that in the ancient times they have the tendency to use more natural materials because they were more readily available, but the materials were poorly understood. And then we had this transition towards the metals. You had gold, which was a noble material, and then we switched to the amalgam, which had the toxicity issues. Then in the 1960s, with the advent of the invention of the polymers and the plastics, we also see this in our profession with the introduction of aesthetic resin polymers and composites. But that's where we have new chemical concerns. Then we have a switch toward modern ceramics, which started to be more biocompatible and inert. And I think in the near future, we're going to see lots of improvements on the bioactive and the regenerative materials, which have been starting to, people have been starting to work on these. And the idea would be to find materials which will allow the teeth to regenerate themselves, or at least help the tooth regenerate instead of creating different health issues inside the mouth and the rest of the body. So if anybody has any questions, I'd invite them to put their hands up virtually or physically.
John D was speaking up a second ago.
Yep.
Okay.
Can you hear me now?
Yeah, sure can.
Hey guys, how you doing? Great presentation. Thanks. You know, it's funny. These things always happen when something's up. I like have a tooth infection right now, and I'm not sure how to treat it. Obviously, my wife first thing she wants to do is go antibiotics, which I'm totally against.
Mm-mm.
But just a question with that, doc. I mean, do you have any ideas on that? And the other thing is, I'm having a hard time. I've been brushing with like baking soda, turmeric, and I hear hydrogen peroxide works well too, but I just don't like using anything with fluoride. Just kind of a double whammy question for you.
So the infection, how does it look or feel? Do you have a
Um,
swollen part at the
yeah,
bottom of the tooth?
it's kind of my upper left. It's not really. It was a bit swollen. I iced it down a bit, and um, you know, and it went down, but it's still a little bit sore, like up in my cheekbone a little. It never a lot of pain. I'm just concerned if I don't do something about it, it could turn into something worse.
Mm-mm. So you talked about the baking soda and the hydrogen peroxide.
Yes,
Normally, there shouldn't be any fluoride inside. So you go to the
right,
pharmacy, you just get here in France, we have them, these bottles of hydrogen peroxide.
right.
That's one thing to do, but that would only work locally. And then if you're looking to use something orally, which would work on the bacteria from the inside out, I would take oregano oil,
Oregano
essential.
oil. And would I just apply that directly to the tooth?
That would be an here we have this great lab which fabricates these caps with oregano essential oil inside. I'm guessing
Okay.
you could find that. So they're to be swallowed. I'm guessing you could find that in the USA or wherever you are.
Well, I'm in Bolivia, unfortunately, but
Uh,
so,
so
but
that
I'm
might
sure I
be a
could.
bit more difficult. Then you have clove oil, which works well.
Clove oil. Okay.
So you can do the oil pulling. You know the Ayurvedic technique with they're using sesame oil. I like to use coconut oil, And in the
Okay.
coconut oil, you would put there's different types of essential oils, but the most important would be the clove oil. And then if you have, you can put lavender as well and tea tree,
Okay.
if you can get a hold of that. That would help
I'm
lower the infection.
okay.
And
Yep.
then it's good idea would be to go see the dentist to see what the cause is, because these are going to work for a while.
Okay.
If it's an infected tooth, the cause is still inside the bone. So
Correct.
without treatment, it wouldn't heal itself, if you wish.
Okay. Find the cause.
Mm.
Thank you.
You're welcome.
Okay, I'll keep my camera off. Sorry, guys. So you, Vlad, very interesting about all the materials throughout time. I wanted to ask you, where do you think that things will go moving forward? Do you have any idea? Because you know the materials today aren't perfect either. They're the ones that are safer are weaker. And do you see anything in development, or do you have any ideas besides regrowing teeth? Because I think that is a possibility at some
Mm.
point when we get there. I mean, I know we can do it now. We just don't know how, and we have everything interfering with that because the body just is wonderful and it heals
Mm.
itself, but we're in the way of that.
Yeah. Well, if you think about it, everything that we see and have today has already been here already. So I think it's just a question of discovering whatever we wish to create. But I agree with you that these materials will exist because it's all in the ether. You just have to discover, like we discovered fire and all the other materials. And if you look on the timeline, um, there's always some evolution, maybe not in the good sense all the time, but we started to have more, like you said, more stronger materials through time. Then we had the more aesthetic materials. I think now it's the time to find the proper materials which would have all these, but also be of natural origin and have a real health benefit. I mean, a health boosting benefit, not just maintaining or worse, lowering your overall health just because you have a feeling or a fake tooth.
Yeah, so the materials that they have today, do you feel like they are on a scale of like 1 to 10, I guess, 10 being the safest, like no reaction whatsoever? Where do you think that falls where we're at right now?
Well, zirconia is very biocompatible, so that's a very good material as far as we know today. Maybe they had the same thoughts back in the amalgam days until they discovered otherwise. But from what we have seen as dentists, in either in the mouth, where you have this nice gingiva attachment, which really attaches to zirconia, which it doesn't on titanium or on the metals, where it tends to go away. That's a very good material being used today, and the ceramics. And then the resin cements are still very much used today, which have all these toxicity issues. And then there's one more thing which people miss: the cements being used to put these inert materials like zirconia in place. So if you have ceramic inlays, for example, you would still use a resin cement, which has all these things. Now there are some resin cements on the market which don't have the bisphenol and the TEGDMA, HEMA. They have other materials, but we don't know if they're. I mean, there are safer than the other ones, but do they have any other issues? So overall, I'd say maybe around a 4 out of 10.
Oh, that's
I,
not so good.
that answers the question.
That's not so good.
We do have the
Um,
good materials, but we really have to do a quite amount of thinking before, like when you put them in place. Okay, will I use this or this? Are there any metals in the mouth? What is the immune situation of my patient? Would I be rendering a service, or would I be causing more damage to this person? I mean, I think that's the way to look at it, as patients being persons, not just tooth holders.
yeah, it's always a cost benefit and pros and cons
Mm,
for sure. I mean, the right answer is take care of your teeth to begin with, and really your whole health. And that's what we're talking about because it's not just about your teeth. Your teeth are healthy because you're healthy. You know, they're even
mm,
looking at now sugar possibly not even being the main cause really
mm,
of
mm.
decay.
You only start to see the top of the iceberg, especially on the
Right.
microbiome research going on.
Yeah.
You
Yeah.
have
And my
all
son,
these.
he's not the picture of health only because of his habits.
Mm,
So if sugar caused cavities, if that was the thing, then everyone who drank sodas and all that would have cavities. So clearly there's more to it. We'll go to Sue for now.
okay.
Hi there. Uh, Thank you. Thank you for this
I
this meeting. My teeth are a bit of a mess. As a child, somewhere around middle school or early high school, one summer I went to the dentist. I had 11 or 12 cavities, and he'd only fill one a week. So the entire summer, every Monday, I was at the dentist again. As I got older, I've had multiple root canals and crowns, and most recently, a couple of implants, or I should say one and a
mhm,
half implants. I don't know. I mean, one of the dentists that did one of the crowns is passed away now. There's no way to know the history of what I've got in my mouth, really. But even as far as the implants, I got scared to do the second one because I heard even titanium may not be as inert as we think it is.
mm.
What does somebody like me do that my mouth is just a mess? And how do I detoxify it besides Masterpiece? Is there anything else?
Mhm. Well, this might sound straightforward, but you would have to find an integrative dentist who has the ability to piece the puzzles together, because you're talking about fillings, then the implants. Indeed, titanium, it was this big, basically how titanium got into the mouth. There was this doctor, Professor Brenmark, from the north, can't remember exact, Denmark, I think, which discovered, I think it was on rats, and for a completely different reason, not for the mouth, he discovered that putting titanium implants inside the bone would create such a fusion of the bone around that it would allow to use it as a support. So that was a discovery. Then you had all these dental implants frenzy. All of a sudden, we can put fake teeth which are not being clipped on the clicked, sorry, on the other teeth, which is great. And everybody has been putting titanium implants, but now you start to see the effects of having. I mean, I'm not saying it's titanium, but you have lots of peri-implantitis, which is the inflammation of an implant. And there's more and more courses every year on how to treat these these inflammations around the implants. And there's some published studies which show that titanium particles from the implant leach out into the surrounding tissue, which and they hypothesize that this would be the reason of the inflammation and even some failures. So that could be an issue, for example, when you have different metals and you stimulate these ions to get out. So in some cases, you could use the titanium implant and everything would be fine when you don't have any other metals, for example. Then you would have to look at the other fillings, and that regular dentists could be able to detect what material they have been made from. And I think we can, no matter where you are on your dental status, let's say, there's always a way to get you back to the surface, be it root canals or implants or not the good materials or allergies or what have you.
Okay, thank you. Is there any safe implant material that you're aware of now? Because one tooth, I had the bone graft done for the implant, but I never went back for the actual implant. So I have a hole. It's a molar in the top right of my mouth. There's a hole, and the tooth below now is starting to grow a little bit taller. This was done right around COVID. So with all that nastiness. So do I just leave it as a hole or and let the bottom tooth grow, or should I look into doing something there?
Well, leaving it like that is not a good idea because teeth are alive and they move, and having teeth misaligned and moving is going to create an imbalance in the, let's say, posture of the mouth, where the lower jaw is positioned in the space, which, being connected by the muscles and the fascia with the rest of the body, is going to create different different compensations in your general fascia and posture. And you can even have for example, there was a case, there was a lady which couldn't get pregnant, and the issue was the imbalance in the muscles from the mouth, which then caused a what's it called? A twist of the uterus. So it goes, just to show you that it goes very, very far. So I would definitely replace it, and the material to use today we recommend the zirconia because it's non-metallic, it's biocompatible and inert, and you have very good zirconia implants on the market today.
Thank you. Thank you so much.
You're welcome.
I wanted to ask you about your patients getting better.
Mm-hmm.
So you no doubt have patients coming to you that are very ill. And I'm wondering, after you take out maybe amalgams the correct way that you do it and also using Masterpiece, like what kinds of results are you seeing with folks that come in real sick and then over time, once they fix their dental issues, do much better?
Well, it's most of the time it's not that sudden, because you have things starting to decompensate in the person's body slowly. I remember a case of a patient. She had arthritis in her elbow. I think it was the left elbow, and her knee and her hips. And she couldn't move her hand. She could only do something like this and here. And I saw on the X-ray that she has an abscess tooth on the same side, lower. It was a wisdom tooth. And I just said, okay, do you want me to test to see if it might come from this tooth? And I did a simple test, and instantly she had her hand go up like this. And even I was shocked. I was like, wow, that really worked fast. So those are the types of things, especially on the posture, which you see an instant reaction. And there's something called the P substance, which is a another neurotransmitter which doesn't get talked about, although it has been discovered, I think 20 years ago. But the other issues are more slow. One more patient, she had eczema on her hands, and we found out that it came from the abscess tooth. Basically, she had root canals, which haven't been done. The tooth wasn't cleaned completely onto the up to the apex of the tooth. I think it was 8 or 9 teeth. So that was a big treatment plan. And after having done that, her eczema slowly went away, but it did. And then there's so many things. I mean, it touches to even your fatigue, for example. You have posture problems because of the mandible. Basically, you're expending energy into these muscles, which would go in another part of the body. So people who are constantly fatigued, you could have heavy metals poisoning as well from the dental materials, for example, amalgam. That's where Masterpiece really comes in handy. And there you could see issues, especially with the bowels and energy levels and cognition, which start to improve. It's hard to do a breakdown of everything.
No,
Even
those were great. Those were great. Thank you. And I love the example of the
Mm-mm.
fascia, because the fascia is one piece and
Yeah,
one
indeed.
part can affect another part. And so just those examples that you gave are excellent for people to think about, because you think, you call the teeth an organ, we're not really taught these things.
Mm.
How important our mouth health is and how it can be connected to so many aspects of our health. It's incredible.
Well, it has its own nervous system, circulatory system, and it's what is it? I know in inches, but it's not far from the central command center, and it's connected directly
To the
to your
to the
brain.
brain?
Yeah.
Yeah. Oh, wow. Okay, sure. That makes sense.
If I can interject, I'm a little upset that they took out my wisdom teeth when I wasn't really old enough to kind of think about the whole procedure.
Mm.
I am just interjecting here. Pardon everybody. But maybe it like took some wisdom from me. Do you have any thoughts on that?
Well, what happens these last decades is we are not eating the same way we used to eat before, as in really using our jaws to chew. There's lots of how do you call it, mashed. The babies, they don't eat raw carrots anymore. They have these prepared foods, so we don't chew enough. And if you have breastfeeding, that's completely different from using the bottle when you don't have to use your muscles anymore. You just put the what's it called, the nip replacement, the bottle. You put it on your tongue, and it just goes into the stomach. And all of this has made our mouths not grow anymore as they used before. So that's why you have the same size of the teeth, but the mandible and the maxilla, they started to shrink.
Oh yeah.
And when an orthodontist looks into the mouth, I don't know why, but the reflex is, there's not enough space for these teeth. Let's take a couple of them out,
Okay,
and
yeah.
either wisdom teeth or the premolars, instead of it creating the expansion to have the place for these teeth and looking at the functions like breathing and swallowing.
Well, I don't
And
know if
no,
I
the
actually
wisdom
had a
doesn't go
problem.
away. You
Okay, the
can
wisdom doesn't go away. Thank you.
no.
And I really don't have a memory or a way of knowing right now whether I actually had an issue worth pulling out or not. But interesting to hear take on how there's kind of a tendency to see like a lack of space in there. But yeah, I do buy that there is like a genuine lack of space issue because of chewing habits. Like we could all chew
Mm.
more and chew harder things, right? Especially like whenever it's appropriate in development. Okay, thanks much. Yeah. Yeah.
I just add there are these articles and books and researches from Weston Price. I don't know if the audience is familiar with them. And basically, what Dr. Price did, he went to see all these isolated cultures, and what he found is that the majority of them had teeth which were aligned. They didn't have cavities, and they had these strong jaws. And then the same ones which then went have been relocated to cities and started to have the habits, eating habits of the people in the cities, which were industrialized. They started to have cavities, less space in the mouth, and also cognitive issues, which is quite an interesting thing to notice.
Was he correlating cod liver, or were other people doing
Yeah,
that?
yeah, he's the
Yeah.
one. Mm.
Well, cod liver sounds good. I'm not sure if it's all vitamin A to do with. Do you feel like vitamin A has an impact on jaw development, though?
Well, I couldn't say if it has on the development because I'm not prescribing it to infants,
Yeah,
but
yeah.
I do prescribe it to people which have my patients, adult patients, which have cavities.
Oh, interesting. Oh, wow.
So
Okay.
it creates a balance, and it's very good because it has the K2, the D3 vitamins, and the omegas,
Right, with the
which
cod liver. Yep.
Mhm.
Okay, awesome.
That's actually part of my prescription for people which have lots of cavities.
So yeah, they had a different diet with Weston Price. Were they also really chewing on things harder, maybe actually
Mhm.
like biting bones sometimes?
Yes.
I don't really know. So that, but the hard chewing was part of his thinking, and then there's
Mhm.
like a nutritional aspect to it as well.
Yes.
Cool. Thanks for
There's,
letting me interject.
There's a
yeah,
hand.
talking about the palate,
That-
there's an interest in that right now. We talked about the Revive Guard, you and I, Vlad,
Mhm.
which I have one of those. It's getting around where it's, hey, let's not pull out teeth, let's just widen the palate.
Mhm.
Let's make the face contour and with what it's supposed to be. And that's getting more to the cause. And you mentioned the lack of breastfeeding as one, and
Mhm.
just the mushy foods, and all of those things play into it. So we can see how continually we have negative consequences for
Mhm.
this quote new way of living, this human zoo that we're in, and the direct effects of Rockefeller medicine. So getting
Mhm.
back to the basics, and how is the human body designed? How are we supposed to live? Get back to that as much as you can. You'll have less problems.
Mhm. Spot on.
Yeah. So I will go to Natalie. She's unmuted already.
This is great. I've got a lot of teeth issues. So when I was a teenager, I had all kinds of amalgams removed, and I think quite
Mhm.
improperly. I had chronic fatigue as a child, and then I got sick after the amalgams were removed. So I was told not to get root canals. I was, in holistic medicine, but in the heat of having abscessed teeth, I did get root canals. And then, so I was suffering with a lot of bipolar and depression for a long, long time. And those,
Mhm.
like let's see, from 214 to like 2000, I was getting infection, like swelling in my gums because of the root canals. And then I was using a Rife machine to take away the inflammation. Um, And then eventually I got a holistic dentist and we removed the root canals.
Mm-hmm.
So I just want to say right after the removal, the bipolar, the mental instability pretty much disappeared.
Mm.
The fatigue, the immune suppression really improved, and I had a bad pain in my right shoulder. It disappeared immediately after the infected root canal was removed.
Mm.
So now I have holes that need implants. And thank you for your work. And I'm excited about the zirconia potential
Mm.
implant. Yeah. So I just wanted to give my feedback on the dental journey.
Well,
So
thank you for that. It's very valuable having someone from the audience talk about this. So
yeah,
you
it's
really have the
all
experience
real.
firsthand.
Oh, yeah, I always recommend people not get root canals because leaving an organ that has been killed in
Mm.
your tissue, of course you will have inflammation because if your kidney is dead, you need to take it out of the body. So why would you leave a living tooth that's been killed? You know, it's gonna have inflammation, of course.
I just
It
had
has
this
to
image.
come out.
You talked about the
Huh?
liver, and I was imagining the liver being stuffed, like the stuffed animals which are dead. And I had this image of someone having his liver being stuffed with, I don't know what they put in the stuffed animals, and then you leave it inside. And yeah,
Yeah.
it's about that in the mouth. You take the pulp out, and then you stuff with something to fill it up, and then you just leave it there.
And yeah, and it starts to, of course, rot and infect.
Mm.
So yeah, I felt immediately better, so much better. I had three root canals taken out in about 6 weeks' time. The dentist spun my blood, made stem cells, filled the hole with the stem cells, my own stem cells.
Mm. The
So I was a
PRF.
good dentist. Thank
Mm.
you so much.
Thank you for your feedback.
I don't want to forget to mention that Dr. Corrali is on social media and he produces a lot of fun little shorts and all your stuff. Well, I think you have a podcast too. I think I've seen one, at least like one or two of those. But
Yeah.
I see your shorts all the time on, I think it's Facebook, but I don't know. I think you might be on Instagram as well. Those are the
Well,
only
it
two
starts
I'm
on
on.
Instagram and then it gets
Okay,
on
those are the only
the
two.
Facebook as well.
Yeah. So we're gonna put in your information again in the show notes when we do get this out. And I don't know if it's in the chat, but I think what is your handle for YouTube is, I forgot,
Dr. Vlad.holistic.
dot holistic. Okay, put that in there. Excellent. Anybody else?
The same on Instagram and Facebook as well, I
Dr.
think.
Vlad Holistic. Sue. Okay,
If
we'll
not,
ask
you
Sue
have
to.
the website with all the links. It's easier.
Yeah, and I noticed you had a masterpiece link on your link tree. That was exciting to see that
Right.
this morning.
Mm.
I do have one more quick question. Are there any dental anesthetics that are safe right now? I'm just a little freaked out about all kinds of injections, and I haven't been doing anything with my mouth because of that fear right now.
Mm.
Is anything safe?
Well, I couldn't really comment on that. We did some microscopy tests. We found some sort of crystals on some, not on others, but at the same time, you don't really know what it is because you would have to have access to very expensive machinery to see if it's whatever you're searching for. So I don't really have an answer to that. It really depends on the country as well, what products are available. There's something I use for numbing the area, which is aloe vera with essential oils, where we also have the clove oil. Yep, that's the one. Clover oil. But other than that, in the anesthesia itself, I wouldn't have a recommendation which would be universally available. I'm thinking about creating maybe one. Why not?
Okay,
Have,
thank you again.
have you heard about, Vlad, the hypnosis, I think it is, way that they can do dentistry so there's no
Yes,
pain?
and I want to do that with my assistant starting September. Have the course to learn how to do that. I saw a dentist. It was filmed, but he filmed himself taking out his own tooth without any anesthesia under hypnosis. So it works wonders.
Wow.
And I also work with a practitioner which does hypnotherapy. That's something I use every once in a while. And she creates these tracks, audio tracks, with the patients, and then I can put the same tracks in the headphones I give to the patients, so they go inside this trance again.
Mm.
But I'm
It,
not yet at the level of zero anesthesia, 100% hypnosis. But I'm getting
is,
there.
yeah, no, I think your direction is super important, and it's not the speed, it's the direction. Do you find that with those headphones that you can use less though?
Not necessarily,
Okay.
because people are still there, if you wish,
Yeah. Yeah.
more or less.
I think
They're
there's some
less
other,
anxious, but I wouldn't say it's significantly less anesthesia. I'd rather
Mhm.
say when compared to a normal person, which would not have these anxieties, for example, you would have to use more to numb a patient which has dental fears than you would a regular patient. And using these tools, you would use the same amount. I'm not talking about hypnosis on the chair, but with the headphones. Because with
yeah, no,
hypnosis, you could use zero anesthesia.
right. Yeah. Yeah. I know there's some other tactics too used in other countries. I don't know if it's China. I don't remember, but it seemed like it was somewhere over there. Acupuncture, maybe. There's just like
Mhm.
zero anesthesia. There's other, you might be familiar. And so I think that's the way to go. That's the future. Why do we need to, use drugs if we don't need to use drugs?
Mm. But we've been conditioned that way,
Yeah.
and
Well,
commodity.
kudos to you for being open-minded about that. I can't wait to hear when you finish that course.
Mm.
All right. Anyone else? My questions are asked. Okay, George, I'm going to have you unmute.
Okay. Now I was wondering, is there a type of controlled layer of uh, Novocaine when you're working on would be working on a tooth? Is there like a protocol where it's only used at it's only done with this type of Novocaine or how would you put it? All the ingredients into that. Because at one point I was there for I don't know, a filling or something, and uh, he gave me the Novocaine, and he came back and he said, "You don't look very good." And I said, "I don't feel very good," because I was like almost out of it. But he added a new uh, addition to the Novocaine, which was epinephrine, and it really messed me up. And he said, we're not going to work on you. You're going to just relax and come down off of this. And I've also heard like during, well, I think it was the COVID era, where a lot of the Novocaine injections by dentists, they had been using some of the snake venom or other ocean critters where they had poisonous venom in there. And it was like giving you the COVID shot without you realizing you're getting a COVID shot as well.
Well, you talked about having epinephrine added, sorry.
Right.
We use that to have the contraction of the vessels, so it would bleed less, and it's also more effective. The
Yeah,
anesthesia sets in quickly.
right. Yeah, that's what they told me, but it affected me really weird. I turned all white, and I scared the dentist. So because he never asked about if I had any allergies to so, and I didn't know I did. So.
But I'm not sure if you had an allergy, because epinephrine is adrenaline. So basically, it goes inside your body, and then all the arteries are going to contract, and that's why you become pale, because you don't have this flush of blood anymore in the tissues, all gets contracted. Heart start to beat faster, and as far as protocols go, we do not use epinephrine for patients which have cardiac issues.
Okay.
That's in the protocols. Other than that, it is being used on a regular basis. You have these vials which are bought and pre-made, and then we only choose one with or without epinephrine. And epinephrine is basically adrenaline, so we all have it in our body.
Right. Yeah.
It's not an allergic reaction, but you are more sensitive to the compound.
Okay.
And
Yeah.
you did right to ask them to not use that one.
Okay. Yeah.
It's a matter of just choosing from the drawer the different vial.
Okay. Yeah. Yeah. Okay. Thank you.
You're welcome. Thank you for the question.
Anyone else? So you're full in on the holistic dentistry in your own practice now, right? You're on your own?
As in the patients that I see?
Yeah, I thought you were working with another clinic like last year.
Yes, I'm in a clinic. We are 6 or 7, and
Oh,
I'm the
okay.
only holistic. I'm the holistic guy.
So how is that looked at by your peers?
Well, and with curiosity, and if it wouldn't have been, I wouldn't be here anyway. So I think we found ourselves in the good team. I mean, the good persons.
Yeah. Well, maybe you'll have some effect on the others.
Mhm. Slowly but surely.
Yeah. Awesome. All right, everybody. Well, we're gonna say goodbye to Dr. Karali. I'm gonna ask all to unmute. If y'all want to say thank you or goodbye or whatever you want to say, you're all able to unmute.
Thank you.
Thank you, doctor.
Thank you.
My pleasure.
Thank you.
Thank you very much.
Thank you so much.
Is that your office behind you, Vlad?
Yeah, I'm on the second floor. Office is downstairs.
Okay.
The barber chairs are downstairs.
Barber chairs? All right. Okay, thank you, everybody. So we'll keep in touch, Vlad. Bye-bye.
Bye, everyone.
Bye-bye.
Thank you.